Hi, and welcome to Hello Live. I'm Pamela Hadfield, the co-founder of HelloMD, and I'm joined here today with Dr. Patricia Frye, our Chief Medical Officer, to talk about brain health. It's a popular misconception that cannabis actually kills brain cells, but the opposite may be true. So before we get right into this, Dr. Frye, I was hoping that maybe you could tell our audience a little bit about yourself.
Thank you for having me here. I am a board-certified pediatrician, trained in anesthesiology as well, and I'm certified in cannabis science and medicine. And I started my career in cannabis medicine right here at HelloMD.
Our first doctor.
I was their first doctor. And it was a slow start. I wasn't familiar with cannabis, but the more I talked with patients, the more I read, the more education I got on the plant and its effects, the more comfortable I became with it. And I feel that it's a pretty amazing pharmacy and a flower, and that people should know about it and have access to it.
So it's interesting, you said that you had a little bit of a slow start at HelloMD, and I love this story just because so many physicians who are interested in cannabis or might want to jump into it are somewhat unfamiliar with the plant itself, and that was pretty much the case with you, correct?
That was the case, and I remember denying recommendations for a number of patients because I didn't think that they were sick enough.
I remember that too.
It's all about benefit versus risks.
Right.
But once I learned that the risks were really minimal, then it helped me to be more comfortable in recommending cannabis for conditions that weren't quite as serious as I thought they needed to be.
Right. And since that time, it's been many, many years that we've worked together. You've seen thousands of patients, not only through HelloMD, but through your own medical practice, and you've even written a book. So maybe you could tell us a little bit about that.
Yes, it's the Medical Marijuana Guide, Cannabis and Your Health, and it covers the history of cannabis as a medicine, the process of it becoming legalized. I review a number of clinical conditions that seem to respond to cannabis, how to tone the endocannabinoid system, which is an underlying system that I'll talk about later, and it is available on Amazon.com.
That's great. Well, that book is just a treasure of information, and I'm happy to say, and I will boast for you, that Dr. Frye is what we consider probably one of the nation's leading experts on cannabis. So if there's anyone to talk about brain health with, it's with you. So let's get straight into it, and we'll start answering some questions, okay?
All right.
So our first question for the day, Dr. Frye, does marijuana actually kill brain cells?
Well, I don't know that it actually kills brain cells, but what we do know is that THC can interfere with some pruning and remodeling of the brain in patients whose brains are still developing, and that's pretty much anyone under 25. We've found that patients who have used high doses of THC over a long period of time, starting in adolescence, show some differences in the size, let's say, of the hippocampus, which is an area of the brain that controls memory. And we don't know the full extent of that because a lot of the studies that have been done really don't tease out other factors that could contribute to some of these changes, like using alcohol or smoking tobacco or poor nutrition. So we don't encourage heavy THC use in people under 25, but there's no data to show that it kills cells.
Okay, so if it doesn't kill cells, but there is some indication that it could be harmful for people under the age of 25, is there any sort of thought about how much THC is too much?
We don't know, and the studies are very limited. A lot of the studies that refer to heavy use are referring to smoking 1 to 2 joints every day.
That's quite a bit.
It is.
So I have an interesting fact. Would you like to hear it?
I would.
So apparently the human brain weighs an average of 3 pounds. The gray matter of the brain is made up of about 100 billion neurons that gather and transmit signals. Did you know that?
I may have known that in medical school, but I think I sort of pushed that to the side to make room for some other facts.
All right. So I just want to remind the audience that if you have any questions, go ahead and use the live chat and ask away, and one of our doctors will answer. So moving on to the second question, what neurodegenerative conditions can cannabis possibly help with?
Well, it can help with a number of conditions: Alzheimer's, ALS, which is Lou Gehrig's disease, dementia caused by decreased oxygen flow to the brain, or part of the aging process. It helps with movement disorders like Parkinson's, Huntington's chorea, Tourette's syndrome. It is a neuroprotectant and an antioxidant, so it can help contain the damage to cells. And the antioxidant effect can really help to minimize the negative effect of what we call free radicals and reactive oxidative stress.
So that's interesting, but just to clarify, it's not going to stop these diseases, will it? Does it just help with the symptoms? How is it working with them?
Well, it depends on the disease or the condition. It definitely can help with the symptoms, but there's certain conditions where both CBD and THC really seem to help slow down the progression of the illness. For something like multiple sclerosis, which is an autoimmune disease, CBD, which is a non-intoxicating compound in the plant, seems to be able to influence that inflammatory response, which causes a lot of the problem. In a condition like Alzheimer's, Alzheimer's is often used generically to refer to any type of dementia. But it really is a specific syndrome where you have these hallmark amyloid plaque depositions or deposits in the brain, and THC has been found to interfere with the deposition of these amyloid plaques. So it too can actually slow down the progression of something like Alzheimer's. In some of the other conditions where we don't know exactly how cannabis may impact the progression of the disease, it certainly helps with symptoms that are commonly associated with these problems, like anxiety, sleep disturbances, depression, memory problems. It is very helpful, let's say THC, in stimulating the appetite. And actually low doses of THC may actually help with memory issues in some of these patients.
Interesting. Well, speaking of interesting, I have my next fact.
All right.
Would you like to hear it?
Of course.
Okay, so quote unquote, alcohol causes brain damage, not cannabis. And this is from a 2017 study conducted by the University of Colorado at Boulder and the Oregon Health and Science University, where they compared the effects of cannabis and alcohol on the brain. The study, which was published in the Journal of Addictions, found that alcohol created adverse structure changes in the brain, while cannabis did not. Do you believe this?
Oh, I do.
Really?
I do.
Why?
I think alcohol is a much bigger problem than cannabis. I don't have a problem using cannabis in young people who have a condition where it's warranted. And again, it gets back to benefit versus risk. But I think that not having a lethal dose, not causing liver damage and a lot of the other issues that are associated with alcohol, cannabis is a much safer drug.
And when you talk about children with conditions, we're talking about things like seizures, and what other conditions are sometimes where cannabis is warranted?
I certainly use cannabis in treating seizures. Children with autism respond especially well to CBD, as the underlying pathophysiology of autism includes abnormal endocannabinoid signaling as well as neuroinflammation. And as you know, we have this endocannabinoid system that's a neuromodulating system, and it regulates a number of other systems in the body. And the brain has more cannabinoid receptors than any other receptor system. So it's very important that signaling be functioning well. And so they've done some studies looking at autism, and find that their anandamide levels are lower than in controls. And anandamide is a cannabinoid that our bodies make.
Also known as the bliss molecule.
It is. And so by adding something like CBD, we can increase those levels of endocannabinoids like anandamide and help that signaling system work better. And so we see improvement in irritability, in sleep, in food aversion. We see all sorts of improvements in autism. Other children who are dealing with cancer, we use cannabis to help as an adjunct to their conventional treatments like chemotherapy and radiation therapy. So I have not had problems using cannabis in children, and I don't hesitate to use it when I think that the benefit outweighs any risk of any neurodevelopmental issues.
And that's what the doctor said. So I want to remind the audience, if you have questions about brain health, please use our live chat and ask away, and one of our doctors from HelloMD will answer. So we actually have an audience question. So the question is this: if I have a cocktail or a glass of wine each night, what cannabis alternative would you recommend I replace it with?
A cocktail or a glass of wine is really not a problem unless you're concerned about the calories. But if you would like to substitute cannabis, if you've never used cannabis before, I would start with a very low dose of THC or THC with CBD. Some people enjoy the euphoric high of THC, and that's fine. Having a puff or two of a flower would be a substitution, or you could use some an edible like a chocolate that has a small amount of THC.
And can I just cut in, because I want to clarify what a low dose is, because I was just visiting my 83-year-old aunt, and I had said to her, you should microdose or have a low dose the first time you have cannabis for her health condition. And I said that was about 2.5 milligrams.
Or less.
Or less.
Or less.
And she went to 2 different dispensaries in Florida and was given between 10 and 20 milligrams and was told that was a low dose.
No, that is not a low dose at all.
Not a low dose.
No, if you haven't used cannabis before, under 2 milligrams is where you start. If you haven't used it before, it's probably not a good idea to use an edible because the absorption is unpredictable. And many times patients will, or they may not be patients, it could be people, don't think that it's working because an hour or so has passed and they don't feel the effects and they take more. And they still don't feel the effects, and an hour later they take more. Well, then it all is absorbed, and then it adds up, and they are not feeling very well. So when that happens, it's not likely to kill you, but it can be very uncomfortable, and you have to wait for that to wear off. But for someone who, say, doesn't like the euphoric effect of THC or doesn't experience euphoria, THC can be dysphoric for a number of people, then a CBD preparation would be very helpful, especially if the goal of having that glass of wine or that cocktail is to decompress, relax, and de-stress. Then CBD is excellent for that. CBD combined with THC can be very helpful in interrupting the stress response, reducing anxiety, helping with muscle relaxation, and just taking it easy in the evening.
So the bottom line, though, is to go low and go slow and take it very easy. And once you find your dose, then go with that.
Yes, because cannabis has what's called a biphasic effect. If you don't take enough, it doesn't do very much, but if you take too much, it doesn't do very much, or it causes the symptoms that you're trying to extinguish. So start with a small dose and gradually increase it until you get the response you're looking for.
Good advice. So are you ready for a third question?
I am.
Does cannabis protect the brain?
Well, I bet you didn't know that we all own a patent on cannabis as a neuroprotectant and an antioxidant, and this was submitted by the National Institutes of Health. Actually, the patent is written for the U.S. Department of Health and Human Services. And this was, the application was put in the late 90s, and it was awarded in 2003 or 2004. And it's very specifically patents cannabinoids, when that would be CBD, THC, all of the compounds that are found specifically in the cannabis plant as neuroprotectants and antioxidants.
But why did the NIH patent this? What is that going to do?
Oh, we don't know.
We don't know.
It probably has something to do with some future pharmaceutical development, I would imagine.
Hazard a guess.
Yes.
Okay, are you ready for our next fun fact?
I am.
Okay, the brain is composed of about 75% water and is the fattiest organ in the body, consisting of a minimum of 60% fat. Did you know that?
I think I did know that at one time.
I did not know that. And what does that mean?
What it says, it's
We
water
just have
and
fat.
fat.
We have fat brains. Okay.
And which makes sense because the cannabinoids are lipophilic. They like fat, so they're attracted to areas that have fat.
Oh, that's interesting. So you said we have more cannabinoid receptors in the brain, and for some reason I thought we might have more in the gut, but I guess if the brain is composed of fat, that would make sense.
No, what I meant to say is that the brain has more cannabinoid receptors than any other receptor system. So we have these different cannabinoid receptors, CB1 and CB2. And CB1 is found primarily in the brain and in the central nervous system. CB2 receptors are found in the periphery, mostly in the immune system, in the GI tract, in the spleen, in the liver, and in other areas in the periphery. So the brain has more cannabinoid receptors than it has dopamine receptors or serotonin receptors or glutamate receptors or GABA receptors. It's a very prolific and promiscuous neuromodulating system.
I always learn so much hanging out with you. Okay, back to the audience. So if you have any questions about brain health, please feel free to use the live chat and one of our HelloMD doctors will answer your question. So what symptoms of dementia can cannabis help with?
Well, it can help reduce anxiety. It can help with sleep. We often see sleep disturbances in dementia. It can help with any chronic pain issues, some conditions like Parkinson's, multiple sclerosis, can have painful muscle spasticity. Cannabis can relax those muscles and reduce the pain. It can help with memory. THC at low doses can help with memory. It's mood elevating. Oftentimes these patients are depressed because of their condition. And with using cannabis, CBD is always safe, or almost always safe. It is the THC that we have to be careful with. So THC at low doses can help with these symptoms, but we don't want to give so much THC that it increases the problem, like causing anxiety, causing discoordination, where we might increase the risk of a patient falling or more adversely affecting their memory.
So I had once spoken to a nurse who worked in an elder care facility, and she had said to me that as the dementia or Alzheimer's had moved along and people were often getting more aggressive, and that elder care facility had found that THC would actually calm the patients down to the point where they were more well adjusted to their environment and were no longer, she said that many were often violent.
And that was also the outcome of a small Israeli study done a few years ago. It was a very small study, but they found that patients slept better, their mood improved, they were not as aggressive or as irritable. And not only did the patients feel better, but the caregivers felt better too, because the patients were so much easier to work with.
Yeah. So are you ready for our next interesting fact?
I am.
Okay, so did you know that Alzheimer's begins when neurons begin to die in the hippocampus region of the brain, which is responsible for forming memories? One of the first and most obvious symptoms is impairment of memory. In the final stages of the disease, the brain will have shrunk significantly in size due to decreasing neurons in different regions of the brain.
You finally got a fact that I did know.
I thought you knew everything. But is the brain shrinking because the neurons are
Yes, it's
decreasing?
called atrophy. And if you look at a CAT scan, you can see these areas of atrophy in the brain, and it's because of neuronal death.
So the neurons, or that electrical impulse, must actually stimulate the brain on some level.
Well, no, that neurons do, that's what neurons do.
And so it's
right,
keeping it alive and healthy is what you're saying.
Well, what they're saying is that those neuronal cells are dying, and so that's leaving space or making space, and so the brain itself is shrinking in size.
It's fascinating and scary.
Yeah.
Okay, so just to remind the audience, if you have any questions, go ahead and use the live chat and one of our HelloMD doctors will answer your question. Okay, so on to an audience question. So this person says, my father actually has a neurodegenerative condition. How do I begin to choose cannabis products for him?
For any neurodegenerative condition, I recommend using CBD and THC together. Certainly we know that if it's Parkinson's, we need THC to help with, to extinguish the tremor. THC interferes with the amyloid plaque deposition that's part of Alzheimer's. But for other conditions, we usually have some element of depression and anxiety, and CBD and THC together work really well for that. So I would start with a high CBD during the day, like a 20-to-1 or even a 30-to-1, and then just gradually increase the THC until that patient is feeling better. The sleep problems can be handled with either high doses of CBD or with using THC. But again, with THC, we have to start with a very low dose. You start once the patient is in bed, and you stay on the same dose for a week at a time before making any increases, because you want that system to get used to the THC. The bottom line is we don't want to make it worse. We don't want to increase the risk of falling, and so it's a process. But CBD, THC together during the day, higher on the CBD than the THC. If CBD at higher doses doesn't help with sleep, then THC at bedtime. For Parkinson's, they're going to need THC during the day to help with that tremor. And again, those patients, I start their THC at bedtime. And I start with a low dose. I stay on the same dose for a week and have them gradually increase that dose every 7 days until they can try a daytime dose.
All right, so our final question. Let's talk about chronic traumatic encephalopathy, otherwise known as CTE, which is the common injury that we hear so much about with the NFL football players. And it's also a traumatic brain injury. Can cannabis help people with these types of conditions?
Well, yes. CTE is caused by repeated trauma to the brain from multiple concussions. And it is really no different in terms of the damage from, let's say, traumatic brain injury from a motor vehicle accident. And there are some studies that have shown that when we pre-treat mice, rodents, with CBD, and then damage them by causing them to have a stroke, that the area of damage is much smaller. Their recovery is much faster and more complete than what occurs with the rodents that are not treated. So this has been something that's also been observed anecdotally in shock trauma units, that cannabis users who sustain traumatic brain injuries tend to do better than the patients who don't have a history of cannabis use. And there has been a big push throughout the NFL to allow these football players to use CBD. I do believe they do use CBD to help protect their brains, but it's also been a source of conflict in using THC. They're still testing the players for THC metabolites, which is unfortunate because, as we know, THC can be very helpful in protecting the brain as well.
And we've talked to a number of pro athletes, whether it be NFL or other sports, and they've anecdotally told us that without cannabis, they would not be in as good a condition as they were today compared to what had happened to them over the years with having so much brain injury.
Actually, in addition to their brain health, cannabis has been a godsend for many of them in terms of musculoskeletal injuries and chronic pain. It's much safer than a lot of the steroids and opioids that they are encouraged to use.
To play through the pain.
Yeah, exactly. And those steroids and opioids aren't really helping with healing, but with cannabis, we're getting that anti-inflammatory response, we're getting the antioxidant protection, and so it actually may play a role in the actual healing of some of these injuries as well.
Well, it's a powerful plant.
It is.
All right, so we have one last interesting fact. Are you ready?
I am.
Okay, so people who experience a concussion or a traumatic brain injury are more likely to suffer from post-traumatic migraines or other headaches weeks or even months after the initial injury due to neural inflammation. Cannabis can aid concussion patients by helping to reduce this inflammation. So our brains are swollen if we've been injured, is that it?
Well, swelling and inflammation can be the same thing, but not always. But I did know that fact.
Of course you did.
Because neuroinflammation is part of the underlying pathophysiology of migraines and autism and a number of other brain health issues. Cannabis is a potent anti-inflammatory, and by reducing the inflammation, it can help relieve pain. With migraines, you also have a neuropathy as part of the signaling, and cannabis can help with that as well.
Well, Dr. Frye, I have to say thank you because that's all she wrote for today. I learned so much, and I hope that you all did too. I just want to let the audience know that if you continue to have questions, go ahead and use the live chat and continue to ask away, and our doctors will answer your questions. So thank you for watching and participating. Please tune in for our next Ask a Doctor series, and we'll see you next week.